Today was an awesome event that we've been doing actually for the past year, which we've been teaching student athletes how to perform CPR. So we are here today with 35 of our University of Pittsburgh Division I track and field student athletes to give them the ability to be able to save a life and potentially help one another, or even more importantly, to help at home.
I was surprised at how common people go into cardiac arrest, especially student athletes. That was honestly really shocking for me to hear, but I'm glad that we all know now how to perform CPR in case that happens to anyone on our team or even one of our coaches.
I was surprised that you don't have to do the mouth breaths anymore, because I know when I learned CPR in high school, we had to do that, like 30 compressions and then the 2 breaths. So it was learning now that we can just do the chest compressions and that's enough. I feel like that makes people feel like more ease to help people around them.
At UPMC Magee Women's Hospital today, we are hosting our 6th annual Physician Wellbeing Symposium for all of the physicians who are employed or affiliated with UPMC. So our goal at this conference is to talk about very different aspects of well-being for our physicians and all healthcare employees throughout the system. Make sure that we're really spotlighting the importance of focusing on this. So we focus on efficiency of practice, personal resilience, and the culture of well-being, and we try to have some talks and talk about the advancements in these spaces during this conference.
The goal of virtually everybody in healthcare is to try to meet the needs of another, and particularly around their health, to get them on a better path, a better trajectory. And physicians do that daily from their role as essentially the leader of the healthcare team. The job is stressful both physically, intellectually, and emotionally. And so we focus activities like today on helping to identify what are those specific stressors, where are the gaps in education or tools or needs, and how can we get them across our physician workforce.
So I think it's really important for physicians as well as all healthcare worker well-being to be front and center of how we deliver care, and that patients know that we're focusing on this, because well physicians and well healthcare workers take better care of patients. There's data to support that they make less mistakes, that they're more attentive to their patients. They actually help the health system work more efficiently and productively, and so we need to help support caregivers to help them take care of our patients.
The secret sauce at UPMC is the people. It's what we do to make life-changing medicine personal to every interaction, and that requires us to have people who are at the best version of themselves, including the physicians.
So the MA training program is a program that we have implemented to offer the opportunity for an individual to learn to be an MA without the expense. Most people don't take the opportunity to get a higher education because of the cost. Therefore, this program gives a new employee the opportunity to learn to be a medical assistant at no cost to them, and also learn not only the didactic and foundational knowledge, but also the clinical skills.
I really enjoy being with a consistent patient population and being able to see them come in and from 2 or 3 years old, and I can get to see them grow as they go, or to be a part of their lives and help them on their medical journey. If they have questions that I can either answer myself or get them in touch with a provider or a resource to answer, makes me feel good to be helpful. I definitely think family care is where I would like to be.